Have you ever felt a deep, nagging pain in your pelvic region, struggled with frequent trips to the bathroom, or experienced discomfort during intimacy, without knowing why? If so, you're not alone. Prostatitis is a condition that affects millions of men worldwide, yet it remains one of the most misunderstood and frustrating prostate issues. Some suffer in silence, unaware of what's happening to their bodies, while others feel trapped in an endless cycle of pain, uncertainty, and ineffective treatments. But here's the truth. Understanding prostatitis is the first step to reclaiming your health, confidence, and quality of life. In this video, we're diving deep into the 4 different types of prostatitis, from the sudden, severe attacks of acute bacterial prostatitis to the mysterious and persistent pain of chronic pelvic pain syndrome. You'll learn: white heavy checkmark, the warning signs you should never ignore. White heavy checkmark, why traditional treatments fail so many men. White heavy checkmark, the surprising connection between masturbation and prostate health. White heavy checkmark, science-backed strategies to reduce pain and improve your well-being. This is not just another generic health talk. We're breaking down the emotional, physical, and even sexual toll of prostatitis, and most importantly, how to manage it effectively. If you're tired of suffering in silence or feeling dismissed, stay with me until the end. You deserve answers, relief, and a path forward. If you haven't subscribed to our channel yet, I encourage you to click the subscribe button and ring the notification bell to stay updated on all our latest content. I'm eager to hear your thoughts on today's topic. If you enjoy the content, please comment 1 below. If it doesn't resonate with you, leave a 0. Your feedback is crucial as it helps me create better videos that align with your interests. Now, let's get started. What is prostatitis? Understanding the pain, struggles, and complexities of this prostate condition. Prostatitis is a deeply frustrating and often debilitating inflammation of the prostate gland, affecting millions of men worldwide. It can bring not only physical discomfort but also emotional distress, disrupting daily life and casting a shadow over one's well-being. This condition is not a one-size-fits-all issue. It manifests in different forms, each with its own set of challenges and complications. To truly understand prostatitis, it's essential to break it down into its 4 main types. 1. Acute bacterial prostatitis, a sudden and severe attack. This is the most intense and dangerous form of prostatitis, striking with an alarming ferocity. It occurs due to a sudden bacterial infection, leading to a rapid onset of excruciating symptoms. Those affected may experience high fever, violent chills, burning urination, intense lower abdominal or pelvic pain, and even difficulty emptying the bladder. In some cases, it can escalate into a medical emergency, potentially leading to sepsis if left untreated. Immediate medical intervention with powerful antibiotics is crucial to halt the infection before it spreads and becomes life-threatening. 2. Chronic bacterial prostatitis, a relentless, recurrent battle. Unlike the acute form, this type of prostatitis is a lingering and insidious condition that can drag on for months or even years. It is caused by a persistent bacterial infection that refuses to go away completely, flaring up periodically and bringing a cycle of discomfort, urinary difficulties, and pain. Men suffering from this condition often describe it as a relentless burden, never knowing when the next painful episode will strike. Despite being less severe than the acute form, it is no less distressing, as it can significantly impact quality of life, sexual health, and emotional well-being. 3. Chronic pelvic pain syndrome, CPPS, / chronic non-bacterial prostatitis, the mysterious and maddening type. This is by far the most common and most puzzling form of prostatitis. It accounts for the majority of cases, yet its exact cause remains elusive. Men with CPPS endure persistent pain or discomfort in the pelvic region for months, sometimes even years, without any clear bacterial infection to blame. The pain can range from a dull ache to sharp, stabbing sensations, often radiating to the lower back, genitals, or thighs. Urinary symptoms such as urgency, frequency, and incomplete emptying add to the frustration. Since no definitive infection is present, treatment can be a long and frustrating process, involving a trial-and-error approach with medications, lifestyle changes, and even psychological support. Many men with CPPS suffer in silence, feeling misunderstood, dismissed, or lost in a sea of uncertainty. 4. Asymptomatic inflammatory prostatitis, the silent intruder. Unlike the other forms, this type of prostatitis does not cause noticeable symptoms. It is usually discovered by accident during routine medical checkups, such as prostate exams or fertility evaluations. While the absence of pain might seem like a blessing, asymptomatic inflammatory prostatitis can still raise concerns, as chronic inflammation in the prostate may contribute to other health issues down the line. Though it does not currently disrupt daily life, its presence in the body remains an underlying mystery, leaving men wondering if it will someday evolve into something more serious. The emotional toll of prostatitis. Beyond the physical pain, prostatitis can take a serious toll on mental and emotional health. The constant discomfort, unpredictability of symptoms, and struggles with urination or sexual dysfunction can lead to frustration, anxiety, and even depression. Many men feel isolated, embarrassed, or hesitant to discuss their condition, fearing judgment or misunderstanding. But prostatitis is real, and its impact is profound. Understanding its different forms is the first step toward seeking help, finding relief, and reclaiming a sense of normalcy. If you or someone you love is battling prostatitis, know that you are not alone. There are treatments, strategies, and support available to help navigate this difficult condition. Don't suffer in silence. Reach out, get informed, and take control of your health. If you are still watching this video and find these lessons useful, please comment number 1 below to let me know that you are still watching this video with me. Common symptoms of prostatitis. Recognizing the warning signs. The symptoms of prostatitis can vary significantly depending on the type and severity of the condition, but many men experience a combination of discomfort, urinary difficulties, and even sexual dysfunction. These symptoms can be distressing, frustrating, and in some cases, life-disrupting. Understanding the common warning signs is crucial for seeking early treatment and preventing complications. Key symptoms to watch for. Persistent pain or discomfort. Many men with prostatitis suffer from ongoing pain in the pelvic region, perineum, the area between the scrotum and anus, lower back, or even the groin. This pain can be dull and nagging or sharp and intense, making sitting for long periods unbearable. Difficulty urinating. A weak, hesitant, or intermittent urine stream is a frequent complaint. Some men experience straining or a feeling of incomplete emptying, which can create constant discomfort and frustration. Urgency and frequent urination. The need to urinate more frequently, especially at night, nocturia, can disrupt sleep and daily activities. The sudden, strong urge to urinate can be overwhelming, even when only a small amount of urine is passed. Pain during or after ejaculation. Sexual health can be profoundly affected by prostatitis, with ejaculation sometimes triggering sharp pain or lingering discomfort. This can lead to anxiety, avoidance of sexual activity, and even emotional distress. General discomfort and fatigue. Some men report a sense of unease, malaise, or constant irritation in the pelvic area, which can contribute to overall tiredness and a decrease in quality of life. Fever and chills in acute cases. When prostatitis is caused by a bacterial infection, flu-like symptoms such as high fever, chills, nausea, and body aches can accompany the condition, signaling the need for urgent medical attention. These symptoms can significantly impact not only physical well-being but also emotional and psychological health. The uncertainty, chronic discomfort, and potential interference with sexual function can lead to stress, anxiety, and feelings of isolation. If you experience any of these symptoms, seeking medical evaluation is essential to determine the cause and explore effective treatment options. Masturbation and prostate health, a complex relationship. Masturbation is a natural and common form of sexual self-stimulation that allows individuals to experience pleasure, explore their bodies, and achieve sexual release without a partner. It is widely recognized as a normal and healthy activity that plays a role in emotional regulation, stress relief, and sexual self-awareness. However, when it comes to prostate health, the connection between masturbation and prostatitis remains a subject of ongoing discussion and research. Can masturbation affect the prostate? Some researchers have explored the potential protective effects of ejaculation, whether through masturbation or sexual intercourse, on prostate health. One proposed mechanism is the flushing effect, where ejaculation helps clear out prostatic fluid, potentially eliminating harmful substances such as bacteria, inflammatory agents, or carcinogenic compounds that could contribute to prostate issues. Potential benefits of regular ejaculation for prostate health. Reduction of inflammation. Some studies suggest that frequent ejaculation may help prevent the buildup of inflammatory agents in the prostate, potentially lowering the risk of chronic prostatitis. Clearing of prostatic fluid. Regular release of prostatic fluid may help maintain prostate health by reducing congestion and preventing stagnation, which could contribute to discomfort or bacterial growth. Lower risk of prostate cancer? Some research has hinted at a potential link between frequent ejaculation and a reduced risk of prostate cancer, though findings remain inconclusive and require further study. Can masturbation worsen prostatitis? While moderate sexual activity is generally considered healthy, some men with prostatitis report that excessive masturbation can temporarily worsen their symptoms. This may be due to increased sensitivity in the inflamed prostate or pelvic floor tension associated with frequent sexual activity. If ejaculation consistently leads to pain or discomfort, it may be worth adjusting frequency or consulting a healthcare provider for personalized guidance. Final thoughts. Finding balance. The relationship between masturbation and prostate health is complex, with potential benefits as well as considerations for those suffering from prostatitis. While moderate ejaculation may help maintain prostate function, excessive or forceful masturbation could contribute to irritation in some cases. The key is listening to your body, staying informed, and seeking medical advice when needed. If you experience persistent pelvic pain, urinary issues, or discomfort related to ejaculation, consulting a healthcare professional can provide clarity, reassurance, and a path to relief. Prostate health is a crucial aspect of overall well-being, and understanding the role of sexual activity in its maintenance is an important step toward a balanced, healthy life. Studies and scientific evidence, unraveling the link between ejaculation and prostate health. The prostate gland, a small but vital organ, plays a significant role in male reproductive and urinary health. Over the years, scientists have sought to understand how lifestyle factors, including sexual activity and masturbation, affect the prostate's well-being. Research has uncovered intriguing connections between ejaculation frequency and conditions such as prostate cancer, prostatitis, and overall prostate function. Frequent ejaculation and prostate cancer risk. Can it offer protection? One of the most compelling areas of research suggests that frequent ejaculation may be linked to a reduced risk of prostate cancer. Several studies, including a well-known 2016 study published in the journal European Urology, found that men who ejaculated 21 or more times per month had a significantly lower risk of developing prostate cancer compared to those who ejaculated less frequently. But what could be the reason behind this? Researchers propose several possible mechanisms. Flushing out carcinogens. Regular ejaculation may help expel potential cancer-causing agents that accumulate in prostatic fluid, reducing their prolonged contact with prostate tissue. Lowering inflammation. Chronic inflammation is a known contributor to prostate diseases, and frequent ejaculation might help reduce inflammation by keeping the prostate fluid moving and preventing stagnation. Hormonal regulation. Some studies suggest that regular sexual activity may help regulate hormone levels, particularly testosterone and dihydrotestosterone, DHT, which play a role in prostate health and cancer risk. While these findings are promising, it's important to note that ejaculation alone is not a guaranteed preventive measure against prostate cancer. Prostate health is influenced by multiple factors, including genetics, diet, exercise, and overall lifestyle choices. However, these studies indicate that maintaining a healthy and active sexual life may contribute to long-term prostate well-being. Impact on vascular function and muscle tone. How masturbation affects prostate health. Beyond its potential role in prostate cancer prevention, masturbation also influences vascular health, blood circulation, and muscle tone, all of which are critical for prostate function. Nitric oxide release and blood flow. When a man experiences sexual arousal and ejaculation, his body releases nitric oxide, a powerful molecule that promotes vasodilation, the widening of blood vessels. This process enhances blood circulation to the prostate and surrounding pelvic tissues, helping to nourish the gland with oxygen-rich blood and maintain its elasticity and function. Pelvic muscle engagement and relaxation. Masturbation and ejaculation involve rhythmic contractions of the pelvic floor muscles, which include those surrounding the prostate. Just like any muscle in the body, regular activity can help keep these muscles toned, flexible, and functional. Conversely, prolonged periods of sexual inactivity could contribute to muscle stiffness or tension in the pelvic region, potentially exacerbating conditions like chronic pelvic pain syndrome, CPPS, or non-bacterial prostatitis. If you are still watching this video and find these lessons useful, please comment number 2 below to let me know that you are still watching this video with me. Balancing frequency and health. How much is too much? While frequent ejaculation appears to offer certain benefits, balance is key. Excessive or forceful masturbation, especially when done compulsively or in a way that causes strain, may have negative effects, such as increased pelvic tension or discomfort, particularly in men already suffering from prostatitis or CPPS. Temporary prostate irritation, leading to post-ejaculatory pain or sensitivity. Psychological effects, including feelings of guilt or distress if masturbation is linked to compulsion rather than natural desire. The key takeaway: moderation is essential. For most men, maintaining a healthy level of sexual activity, whether through masturbation or partnered intercourse, can be beneficial for prostate health, as long as it doesn't lead to physical discomfort or interfere with daily life. Final thoughts: a science-backed perspective on prostate health. Scientific research continues to shed light on the intricate relationship between sexual activity, ejaculation, and prostate well-being. While regular ejaculation may help maintain prostate function, promote vascular health, and potentially lower cancer risk, it should be considered just one piece of the puzzle in a broader approach to prostate care. A well-rounded lifestyle that includes a nutritious diet, regular exercise, stress management, and routine medical checkups remains the best strategy for ensuring long-term prostate health. For men experiencing prostate discomfort, urinary issues, or persistent pain, consulting a healthcare professional is crucial to determining the right course of action. By staying informed, listening to your body, and making proactive choices, you can take charge of your prostate health and enjoy a balanced, fulfilling life. Myths and realities about masturbation in men with prostatitis. Masturbation has long been surrounded by misinformation, stigma, and outdated beliefs, especially when it comes to its impact on prostate health. For men with prostatitis, these myths can lead to unnecessary fear, guilt, or even avoidance of a natural and healthy aspect of sexuality. Let's separate fact from fiction and shed light on the truth about masturbation and its role in prostate health. Prohibited myth: daily masturbation damages the prostate. White heavy checkmark reality: there is no scientific evidence to suggest that moderate masturbation harms the prostate. In fact, some studies indicate that frequent ejaculation may help flush out inflammatory agents and reduce congestion in the prostate gland. This process can promote overall prostate health and may even have protective benefits against certain conditions, including prostate cancer. The key factor is moderation. Excessive or forceful masturbation might cause temporary discomfort, but it does not lead to permanent damage. Prohibited myth: abstaining from masturbation is the best way to heal prostatitis. White heavy checkmark reality: complete abstinence from sexual activity is not necessarily a cure for prostatitis. On the contrary, a lack of sexual release can lead to pelvic muscle tension, reduced blood flow, and increased stagnation of prostatic fluid, all of which may contribute to persistent discomfort. Some men with prostatitis find that regular but moderate ejaculation helps relieve symptoms, while others may experience temporary irritation. The best approach is to listen to your body and find a balance that works for you. Prohibited myth: masturbation can replace medical treatment for prostatitis. White heavy checkmark reality: while ejaculation may help maintain prostate function, it is not a substitute for professional medical care. Prostatitis, particularly bacterial forms, often requires medical treatment such as antibiotics, anti-inflammatory medications, or pelvic therapy. If you are experiencing persistent pain, urinary symptoms, or discomfort, consulting a urologist is crucial for accurate diagnosis and effective management. Recommendations and strategies for men with prostatitis. If you are navigating prostatitis and wondering how masturbation fits into your overall well-being, here are some evidence-based strategies to help you maintain a balanced and healthy approach. Small blue diamond: consult a specialist. If you have symptoms of prostatitis, seek guidance from a urologist to determine the best course of treatment. A professional assessment can help identify whether your condition is bacterial, inflammatory, or related to pelvic floor dysfunction. Small blue diamond: regular medical follow-ups. Stay in touch with your doctor to monitor the progress of your condition and adjust treatments as needed. Prostatitis can be complex, and ongoing medical support is key to finding long-term relief. Small blue diamond: practice moderation and self-awareness. Masturbation is not harmful when practiced in moderation and with mindfulness. The goal is not complete abstinence, but rather finding a frequency that does not cause discomfort or exacerbate symptoms. Small blue diamond: listen to your body. If you experience pain, irritation, or discomfort after masturbating, consider making adjustments. Reduce frequency to see if symptoms improve. Experiment with different techniques that put less strain on the pelvic area. Use lubricants to minimize friction and irritation. Engage in relaxation techniques to reduce pelvic tension, such as deep breathing or pelvic floor exercises. Small blue diamond: adopt a holistic approach to prostate health. Your prostate health is not just influenced by masturbation or sexual activity. It is deeply connected to your overall lifestyle. Maintain a balanced diet rich in anti-inflammatory foods, such as leafy greens, berries, and omega-3 fatty acids. Engage in regular physical activity to improve circulation and reduce stress. Manage stress levels through relaxation techniques, meditation, or therapy. Stay hydrated and minimize excessive caffeine or alcohol intake, which can irritate the bladder and prostate. Final reflections: empowering your sexual health. The connection between masturbation and prostate health, particularly in men with prostatitis, is a multifaceted topic where biological, emotional, and lifestyle factors intersect. Science does not support the notion that masturbation is inherently harmful, and in fact, evidence suggests that regular ejaculation, when done in moderation, may be beneficial for prostate function. However, every individual is different. If you notice that masturbation triggers pain, irritation, or discomfort, it is essential to pay attention to your body's signals and seek professional guidance. A personalized approach, rather than a one-size-fits-all solution, is the best path to maintaining both prostate health and sexual well-being. Your sexuality is an integral part of who you are. Taking care of it means staying informed, communicating openly, and respecting your body's needs. Don't let myths, outdated beliefs, or fear prevent you from embracing a fulfilling and healthy sex life. Masturbation, like any other aspect of health, is best approached with knowledge, balance, and self-care. It is not a cure, nor is it a threat. It is simply a natural part of human sexuality that should be integrated into a comprehensive plan for physical and emotional well-being. Thank you for taking the time to explore this topic with me. I hope this information has provided clarity, reassurance, and empowerment. Remember, the key to lasting health lies in education, balance, and a commitment to self-care. Blue Heart. So, after everything we've covered, what have you learned about prostatitis and prostate health? Have you discovered something new that you'll start applying in your life? Whether it's understanding the different types of prostatitis, recognizing symptoms early, or finding the right balance when it comes to masturbation and prostate care, Let me know in the comments below. Your insights matter, and sharing your thoughts can help others going through the same struggles. Drop a comment and tell us one key takeaway from this video and how you plan to use it in your daily life. And if you found this video helpful, please don't forget to like, share, and subscribe to our channel. Your support helps us bring you more valuable content on health, intimacy, and well-being as we age. See you in the next video. Blue Heart.